Virtual Nursing Revolution, how human-centered AI is redefining healthcare's largest workforce. This session features Dr. Christine Gall, who serves as Chief Nursing Officer at Colette Health, where she leads clinical operations and innovation and virtual patient observation to enhance safety and outcomes across hospitals nationwide. She brings over 3 decades of nursing, patient safety, and quality improvement experience with advanced training in public health, leadership, and healthcare management. And Becky Fox, who previously served as Vice President and Enterprise Chief Clinical Information Officer at Intermountain Health and, has since founded Vital Circle, where she brings her expertise to create solutions that support clinicians and improve patient care. She is a nationally recognized nursing and health IT leader with extensive experience driving digital transformation, clinical innovation, and patient safety initiatives. And moderating this conversation, last but not least, is Megan Antonelli, the CEO and founder of Health Impact Live, a media and events platform that accelerates innovation to enhance patient outcomes. She launched Health Impact as a CIO forum that has grown into a renowned catalyst for healthcare transformation and was recently named Director of Emerge Health. Megan, I'm going to turn this conversation over to you, and I look forward to hearing what y'all have to say.
Thanks, Carol, and thank you, Becky and Christine, for joining us today. What great conversations we've already had, and I think it just tees us up. I know Dr. Gain talked about how, these technologies, whether you're in rural health systems or urban health systems, are being implemented in various capacities. And both of you have such incredible experience, Becky at Intermountain and Atrium, and Dr. Gall at HCA and others, and of course now at Colette. Why don't you kick us off and tell us a little bit about what you're seeing? What are these virtual nursing practices look like, and how is it changing the role of nursing?
Well, thanks, Megan, for the opportunity. And Becky, it's really nice to have the opportunity to speak on this important topic with you as well. Virtual nursing has really gained some incredible momentum, even though it's something that we've all been talking about for years and years. We all know, I'm not even going to mention the name of what happened in 2020, but there is definitely an igniter that occurred for us all. And what it really did in my mind is it brought together the famous myriad of issues that continue to this day to be pain points to address. That being things like the workforce shortages, and workflow burdens. When I look at how we evolved in the profession over the 3+ decades that I've been here, starting out pre-EHR and then the integration of the EHR, that created a lot of opportunities and solved some incredible problems, but it also presented and posed a lot of new challenges and sometimes burdens to nursing workflows. I think we are now in this place where, given the complexity of care, along with the shortages in key resources, as well as financial burdens, we now need to look at how we're delivering care differently, and virtual nursing definitely allows for that. When you look at virtual nursing and virtual care in general, no two organizations are doing it the same way, and that's because no two organizations practice the same way. Their culture is unique, the types of patients they take care of are unique, and therefore virtual care is also going to be unique. When I look at some of the challenges that the frontline nurses face, I was recently digesting an American Nursing Foundation article, and about a third of the time that nurses spend on shift each day is spent in the room. That means 2/3 is outside of the room. And of that 1/3 of time in the room, about half of that time is actually spent engaging with the patient. Other times are spent in doing other tasks or engaging with technology and documentation. Overall, about 25 to 41% of time is spent in documentation, and another 10% is spent in tasks that could be delegated to somebody outside of the nursing realm. So I think we have a number of different opportunities and challenges to address, and I think virtual nursing is poised to do that.
Yeah.
To add on to that, Megan, I think one of the exciting part is it is an exciting time. Nurses are at the table, they're in part of the conversation. And as Christine mentioned, it's an opportunity to really innovate of what this looks like in the future. We've not to date all of us, but we've all been through this journey of, okay, we just need to take the paper and put it in the computer. We just need to replicate the exact same thing. And yes, we have alerts and clinical decision support that helps guide and increases our safety and quality and outcomes. But the reality is now we get this opportunity to really rewrite what that patient experience is like, what the staffing experience is like, and even what the operations experience is like. So when the nurse comes to work, if it's difficult to get scheduled or know your schedule for the next 2, 4, or 6 weeks, and now AI can really change that and enhance that experience, then that really decreases burnout, makes an impact on the stickiness of our employees to staying with an organization. And we know that when you make nurses happier in their work life, we know that impacts the outcomes that we see in our patients. And so we're really excited about the opportunity that, hey, the world is really the oyster again. We get to reset and redefine exactly how technology will drive how we deliver care.
Yeah, I think that's so important. And I think when we hear about these changes, and of course, what we saw during the pandemic, I'll say it, even though it's a long time ago and it's still around. But the ramifications of that, what it exposed, and then the innovation and the changes that it brought about, in that it was in some ways a silver lining, particularly with technology adoption, but a lot of it came down to exposing the lack of capacity, right, and the scalability of the workforce. So, but at that time, we wanted to remove human touch. Now we want it back, right? We want our nurses to be there. We want that to be a part of that. When you're adding these elements, these new technologies, how can we balance that in terms of the human touch as well as efficiency, right?
To me, the big thing is really making sure, again, nurses are involved in that process so that you're getting real-time feedback of whether or not something's working. And then also the other opportunity, one great thing from the pandemic is we learned to leverage each other's skills, meaning collaboration across organizations. So for example, if Tampa General has figured out how to make the staffing experience better, then we all should learn from Tampa General, regardless of what tool and technology they're using, and now leapfrog upon that. So I think those lessons came at, let's just say, the last 5 years, a lot of learning from each other and sharing that information, and then being able to build upon that. So I do think there's some stepping stones still to come. And I'm happy that some of those things have already started. So being able to collaborate on sessions like this with Health Impact, of course, it's almost conference season, so everyone will be getting together, but just being able to leverage technology to share. So for example, many of you can go to ChatGPT or any tool that you like and say, tell me the best, the top 10 organizations that have made an impact on staffing, on documentation, on burnout, and very quickly know what your colleagues are doing. Now you still have to rely on the old school way of sending them an email or connecting with them some other way, or maybe on LinkedIn or some other social media. But at least it can help people really leverage that technology and the data source and pulling information and make a better step forward. I was just talking with a colleague of mine 2 weeks ago, and they were talking about putting together a business case, and we were somewhat laughing that 10 years ago, to put together a business case meant literally doing literature reviews and trying to find out what one organization did or another organization, and then crafting their own pilot and plan, and then looking at data to get the proof points and the financial and hourly impact that a project might now have an impact on. And now they were able to say, hey, I'm using AI to help me write the business plans. Now I'm still vetting things, I'm still validating details, but I can't believe of what an impact that it's made. So it really is changing how we train our leaders, how we train nurses when they come out of nursing school to use these tools in better ways that will have an impact for all.
Now, I like what you mentioned, Becky, about, the need to keep the skill level where it needs to be. When I think about how you leverage technology for nurses at the bedside and how AI can drive things like outcomes for patients that have complex discharges and are going home. That's work that I do every day with leaders across the country, looking at, these are the most critical points in a patient's discharge. And if we get it wrong, if they fail to understand what we're communicating to them, the natural effect and impact can be further injury, lack of healing, and unfortunately complications and maybe even ER visit or a readmission to the hospital. So when I look at how we leverage technology and how the AI burden or AI can help lift some of that administrative and oversight burden, or even bring people to the right lane saying, here's your line of sight. This is what's most important given the data that are available. I think that that's going to really be a game changer. But back to our initial conversation, we have to make sure that the people who are doing the work and the people who are going to have to ensure that the work is successful. We have to ensure their buy-in and their adoption. And the way to do that is make sure that their voice is present, ever present throughout every phase. We also need to help our leaders, having the skill set to lead through a sweeping organizational change that is going to impact the fundamentals of how you provide care is not a skill set that everybody is born with, nor, goes through nursing school and just it magically appears. Something that needs to be developed. So I think that change management is a really important piece here to think about, and how we set our leaders up for success, to make sure that they are leading and providing the right guidance and guardrails for their bedside staff, who also haven't been really trained at things like workflow enhancements or process improvement, how they give them real time the guidance that they need in the support and structure so that the right decisions are made given right now. And then through what we all do every day, our Plan, Do, Study, Act, our continuous improvement cycle, we all know that nothing will ever be perfect initially. So with those rapid cycle improvements, we need to make sure that we are using data that has to be organized up front as we're determining how to develop and ensure that we have a way of tracking our success when we're launching these projects. But then how we actually use the data to determine if, yes, we can adapt this workflow and this project as is, whether we need to further adopt it and make it better, or whether, hey, this is not working, this solution is not working for this product or this particular issue right now, so we're going to shelve that and move on to something else.
Yeah, that's great, Christine. I mean, Becky, you mentioned too, I mean, sort of the nurses being part of this discussion and how that's happening. Christine, as you're working with, I mean, you guys work with hundreds of hospitals and health systems, and I'm sure very different culturally and organizationally, and also different places in their, technology implementation cycle. Are there some sort of best practices in how do you get the nurses involved in these conversations? Because they're very busy, and it's hard to, find the time to make that happen. So what are some of the tools and tricks you use across these organizations?
Well, obviously there has to be an awareness, at the senior levels, that shared governance, which is, as we across the country are working on magnet journeys and really elevating the practice of nursing to be that professional body that can guide its own practice. We need to make sure that we're resourcing that, both in time away from the bedside to actually do the work, in a protected manner. And I know that today that is becoming increasingly challenging, and therefore we need to figure out ways to make that still possible. And having, in addition, not just having meetings, but just in time ways for leaders to gather quick feedback in the form of checklists, just-in-time conversations that they're collating the data to be able to drive and inform the decisions that are made on their behalf, as you're looking at workflows. So that's one level. The next level is obviously at the staff level. We work very diligently with our partner customers on strategies, communication plans, first to help people understand what are we doing here if we're embarking in bringing in a new technology, for example, to do virtual observation. Why are we doing this? We can't just start saying, here's the technology, this is how you use it, go. That is a failure every time and leads to the what I like to call the cemeteries of unused, very expensive equipment that we've all unfortunately collected over the years. It's really important first that you position your staff to understand why we're making a change. What are the factors? What are the drivers of that? And what is the default future that's going to be created if you fail to make that change? And then bring them along with what will this change do for you in your practice and what is it going to do for your patients? If you connect them to those pieces of information, the majority of folks are going to either lean in overtly or they will be, passive supporters until they really get it and then they can move on. That really eliminates some of the folks. And I like to use the analogy that in the absence of information, people will hear part of a story and they'll fill in the rest of it with their own information. And if you don't give them the full, complete picture and iterate on that as events happen, as situations occur to continue that conversation, a lot of different things can happen and that can be detrimental to the progress you're trying to make. So those, I think, are a few best practices that I really try to support.
Just add to that too, one of the things that's we're lucky in is that AI, years ago, I would say that many people were a little bit terrified of it. Now it is pervasive everywhere. So if you're doing any online shopping, there's a new AI tool that you can try out to see if it can help you enhance your shopping experience. You may, even when you go to the dentist, ask them about how they're using AI. So it's part of everyone's conversation. If you're in the travel industry or if you take a trip or a vacation, you more than likely are coming in touch with some type of tool that leverages AI and technology. So the great thing about it is in those conversations, whether you're having with the senior suite, the managers, or the frontline staff, they're now being exposed to AI in other aspects of their life. And that is good and bad in many ways. Because number one, they're going to leverage those experiences and then also compare how you use that AI in their work life experience. The other thing that you'll find too is the patients themselves are also getting engaged, leveraging tools. I'm sure that many of you have had the experience where, especially if you're a nurse or a physician or any clinician, you have a neighbor, a friend, a family member that will say, hey, I have these 3 symptoms. What do you think of this? And then the next sentence now that I'm finding in conversations is, and this is what this AI tool told me that it might be, or a treatment that I should consider. So patients are also engaging in these tools. And of course, our EMRs and other tools that we're using in our daily lives are also embarking in ways to improve both operational efficiency. So whether that's doing ambient listening and doing documentation, whether it's doing predictive scheduling for an OR or for staff, whether it's even helping from a supply chain perspective, or even looking at weather to say, we anticipate that staffing might be difficult on Thursday because we can see that there's a snowstorm coming. These are the types of things that are impacting the daily lives of our workforce as well as our patients. And so I think it will help us in getting adoption once everyone continues that journey of trialing things out and getting more comfortable with these tools. I know I saw one of the questions that came up that talked a little bit about, there have been several failures in a project. And of course, everyone has that adage of, if you're going to fail, fail fast. And the reason why is to learn. So even though it's a failure, what I would say is in that we still carry the ball forward. We still learn lessons like, oh, we really should have, instead of week 4 talking to the frontline staff, maybe we should have done that at week 2, or maybe we should have had a different exposure to that. I do think that in any project that you're doing with AI, good, bad, or indifferent, you will learn nuggets of wisdom. You need to leverage those, pass them forward. And then the other thing is share them with colleagues outside of your organization. A lot of people don't want to do that and say, let me tell you about how a project went sideways, but that's the best lesson and collaboration that you can do if you want to really make an impact on healthcare, is sharing the information of what you've learned.
100%. Thanks, Becky. Yeah, I know. And that's, I think the question or the comment from the audience around those failures and how it has to do with change management often. But also, I mean, to harken back to the last conversation in terms of the risk, making sure you make the choices with the programs that are maybe perhaps a bit lower risk, so that failure doesn't expose you to things that, obviously impact patient care and things like that. Are you seeing that, sort of strategy, Christine, in your implementation?
Yeah. Absolutely. When you look at where to start, where to dip your toe into virtual care, I think it's really important to recognize that for bedside staff, just the ability to work with a colleague who's virtual is a new skill set. So therefore, starting with something that is definitely lower in complexity is important. So when I'm having conversations with my colleagues across the country, we usually start in the virtual observation space. The reason is, you have a staff person who's responsible only for monitoring and reporting and documenting. They're not and alerting, obviously, if there's risky behavior. So it's not a skilled task to do that. Therefore, it gives the bedside staff, the bedside nurse, the ability to know how and when and how best to communicate with their virtual colleague. So it's a safe space, and pretty easy. Usually the focus is on safety. Sometimes it's on safety plus maybe patient experience when it relates to, for example, patients in isolation, and we're going to come upon flu season. So observation is one of those things that might help that very anxious patient in that room with, with isolation, to maybe pause from using their call light every 30 minutes, because if that observer recognizes the pattern, and if that bedside nurse has given them the information that they need with which to engage, the coaching that I do is very proactively that observer is going to engage, develop a relationship so that they can say, you know what, I know your nurse is coming back in about 30 minutes. Let's talk about what you need. And I'm going to send them a message that when they come in with their gown and their gloves and their mask on, they're going to have everything you need. So that's one proactive skill set that I think is important. And then helping people as they're ready to go to that next step into virtual nursing, which is, stratospheres above virtual observation. Then we talk about what are those discrete but time heavy activities that you can offload from that bedside nurse. And as we know, the average tenure of the bedside nurse is dropping over where it was when I started a few years back. So we really need to help those nurses, because, even if they have the same ratio of patients, the acuity and the complexity of care are more than it ever was when I was at the bedside. So looking at things like admission and discharge and transfer, and what are the non-hands-on activities within those very discrete and understood activities that you can do and peel off of the bedside nurse. How you communicate, though, that becomes one of the biggest areas of risk and opportunity. It's so very important that the workflows and the communication between the bedside nurse and the virtual nurse are very well thought out, so that the work of communicating between the two disciplines doesn't become a new burden. So those are the kinds of conversations that we have. Where is the best place to start when you're getting into virtual nursing? Where do you want to build that skill set and that talent pool amongst your staff before you go into maybe some more complex kinds of virtual care situations?
Becky, have you seen that as well in terms of the implementations and things you've seen at various organizations?
Yeah, the other thing, just to also draw, one of the questions came up too about tying into pharmacists. How are pharmacists? So while there's, and I'm very thankful that there is a big focus on virtual nursing, because nurses have been living through a shortage for some time and we need to do things differently. But understand, it's not in only nursing that can be impacted by this technology. So I have seen organizations really use it for meds reconciliation, to really have a connection with the patient, so that the patient understands what is their medication plan, both while they're in the hospital and outside the hospital. And so it's not just for nursing, it really can be leveraged in many different aspects, whether that's admitting the patient, discharging the patient, educating the patient, really managing the patient from a physical therapy perspective, a pharmacy perspective, and medication management. And then really even just from a navigator perspective. So I have seen organizations go down the path of saying, hey, we have patients that will be on a certain care path, whether in the hospital or out of the hospital, and they may see different specialists. And I need someone to help guide them. But we can centralize that person, and yet they can connect to many different sites and many different patients and help guide the care. And most importantly, bring efficiency. Like Dr. Gall said, when you don't fill in the blank for the patient, they make up their own story of what's going to happen to me. They worry, they become more upset. So if we can help answer questions faster, give them the information that they need by leveraging technology, and it doesn't matter if you're a pharmacist, a physical therapist, or any other ancillary, any person on the care team can use this technology to make an impact to your patients. It is great, again, to learn from the lessons. What did the virtual nursing team learn? How can they build upon that? What's different in the pharmacy space or the physical therapy space? And just remember, it's not a one and done. So anything you learn, you're going to hopefully be better today than you were yesterday. We'll continue to evolve, continue to learn, and really leverage this technology. The other thing that I often say, our teenagers are going to save us all. Teenagers are very well skilled. I always say, like, if we want to figure out a problem that we're going to put in place, like, a solution we're going to put in place in 5 years, let's go ask the teenagers of today, because they're going to be in the workforce coming. And if you watch, I'm not a big, voice to dictation kind of person on my phone, but my teenagers do it all the time. So they are telling, whether it's Siri or Google or whoever, what to do or how to make a task list or how to get things done. It's amazing to me when you see how they've adopted those types of technology. I think that's what's going to also have an impact. So the teenagers are going to save us all. They'll help find the answers. But that's how we have to really collaborate together. And that's what also helps the implementations. It's less scary for the care management team to know about how they're going to implement this technology if they've heard from the inpatient nursing unit of how they've successfully used virtual nursing. So that's the other thing I would say. I can stand up and say, this is how great virtual nursing is, and this is the data, and this is how we did the implementation. But there's no better advocate than a person who's either been the virtual nurse or received support from a virtual nurse. And that is just a priceless aspect that you have in your organization and you can leverage to, again, help move things forward.
Megan, can I just dovetail off that for just a moment? You made me think, Becky, when you were just mentioning that, there are technologies that can ambiently and automatically and non-invasively evaluate patients according to their anxiety level. And when I think about the ability to retain all the information that's coming at you when you're sitting in that hospital bed, and how, if you don't have the insight, so think about that nurse, as I mentioned with my stats earlier, if their only glimpse of this patient is maybe a full hour a day, and that's maybe spent engaging with the patient 20, 25 minutes of that full hour, their ability to really sense what's happening with that patient might be limited. So if you actually have the AI support to say, this patient is hyper anxious, and you're about to load onto them, this incredible discharge, story or information, or you're handing off to the virtual nurse to do that. Wouldn't it be great to have technology, which actually exists today, to say, you know what, you need an advocate with you in the room that's going to be with you at home. So I know your daughter you live with your daughter and she can't be here right now. So let's bring her into this conversation and let's engage her in to make sure that she hears what you're hearing, that you together know and are prepared for what's happening once you leave the doors of the hospital. So I think that, involving the patient's advocates as a member of the care team is an even additional benefit of everything that we've been talking about with AI and leveraging technology for virtual care.
Yeah, I mean, I think what you said in terms of just the fact that a nurse, participating with the observational nurse is a new sort of experience, and that in and of itself is changing the practice of care. And then you think of all the other collaborative teams that are now able to participate, and this isn't cutting edge technology. It's literally what we're doing here, right? I mean,
Exactly.
and it's an amazing thing to think about how that will impact care management and the collaborative team, whether it's pharmacy or psychiatry, to kind of bring that in. And then, yes, the technology that can kind of, observe and monitor that even without a human involved through ambient listening is phenomenal.
Fascinating.
Yeah.
I just add,
ahead,
sorry if I could, just to take over right there. Just to add to that though, is to me, it's really exciting about the aspect that I cannot wait. I am dating myself, but I remember talking with folks that developed the skin assessment, Barbara Braden, Nancy Bergstrom, and how we went and we said, everyone has to document this on every single patient every single day. And so nurses across the United States and around the world have been documenting it on paper, also in electronic, etc. I can't wait for the day to celebrate where we say, you know what, we didn't have to do that anymore, because the AI told me the risk of this patient having a skin breakdown in the 3.2 days that they're going to be admitted to the hospital is 0.0001. We're not even going to have to do that assessment. And now we can truly take away additional burden and documentation that really is no longer required, that we can leverage the technology to help with that documentation and relieve the burden of those things. I'm sure many of the nurses on the line here would say, oh my gosh, there's 10 other scales that I wish we didn't have to do every day. We do them because of regulatory, we make consistency, we make standards, which means we have to look at how we do assessments of patients, how we do interventions and treatments of patients, how we do care planning, and figure out how to do that differently. So my little thing out to the audience is the call to action of, this is where we need creative people. We need creative people saying, hey, I just realized that if we leverage technology, this is how it can present differently to the nursing staff. And this is how we could really change how we do what we consider our standard. This is how we evolve our standard into a better way. So we've seen great examples of that around AI, virtual nursing, and we've seen it around staffing and documentation, but we need to continue to take it forward to more complex things like care planning, longitudinal care planning across different encounters, and really make a difference. And we need the creative people at the front lines that are helping to say, what if, how could we, what could we try differently to really evolve healthcare as it is today.
Yeah, and I think that was actually where I was going in terms of kind of the nurse satisfaction, right? So we're seeing and talking about kind of how we're changing the patient experience. What are you seeing, Dr. Gall, in terms of, the nurse satisfaction and their happiness with these tools with respect to reduction of administrative burden and things like that?
When I think about where nursing is going and what the drivers of resilience and satisfaction are, to me right now, I think that we have an opportunity and a responsibility to really look at level setting some of the ways that the work is happening. Again, hearkening back to some of the stats that I talked about, people generally are going into nursing because they have this compassion and this need for human connection. And to be very honest, many of the drivers of what makes nursing successful as a profession relate to that engagement and an interaction that occur between patients and nurses. You know, to this day, I started out on a pediatric cardiac surgical unit for step down ICU patients. And to this day, I will do a head to toe on every beautiful little baby I see to see if there's any evidence that they have a cardiac defect. I mean, it's just ingrained in me. And the reason I just bring that up is I think that it's important. We really, since the EHR implementation, I think that this is the biggest shift and opportunity and challenge for the profession of nursing, and that is bringing in virtual care and technology that might be AI enhanced or driven. How do you do that well? And I think that we have to start with a lens and the optics that part of what needs to happen is we need to right the ship that has been iteratively created over time, where, you know, it now has led to, when I think about when I finished nursing school, it was like I finally got through that 4 years. It was amazing. If I would have thought that within a year, 1 out of 3 of my friends or I would have left the profession altogether, I couldn't have imagined it. But we've now created this dynamic set of circumstances that in my mind very few people could actually get through without a lot of support. I think that virtual care is a huge strategy, but how we enact it and how we enable it and how we support and leverage both the novice nurses and the nurses who have expertise but may not be those technology grabbers that really have that expertise. So we have to figure out both ways. And so to do that, in my mind, we have to first start by understanding that AI and virtual care is not going to replace staff at the bedside. It's not going to replace physical beings, but it's going to make sure that the way that work is done is going to reduce burnout, is going to improve the patient experience, is going to prevent avoidable complications, is going to prevent avoidable harm. And therefore, all those more lagging metrics that we don't usually equate to the FTEs that we're using today to manage this particular shift or this particular, budget cycle, we need to think more broadly and bring all of those metrics into the consideration, because they all flow from, is this a manageable assignment, and is this a manageable workload and expectation of somebody long-term?
Yeah, no, I think that's also important. Yeah, Becky, did you want to add something?
I just think it is really exciting to look at how far we've come. I was thinking back to, the first smartphone that we rolled out in a healthcare system and how long it took to adopt that. And yet now today, you can't imagine walking into any healthcare system and the nursing staff not having a smartphone technology in their pocket. So we hope that virtual nursing and all virtual aspects continues to evolve in that space. So that's what I think is exciting. Is, to me, it feels like it's happened quick. There's still much more to go, and there's still many organizations to join in that aspect of virtual nursing, but it's much more commonplace to hear it, to talk about it, to learn from it. And so it makes me really hopeful for the future that we'll continue to evolve healthcare and make a real difference to patients' outcomes and the communities that we serve.
Yeah. Absolutely. In the last few minutes that we have left, we always like to talk about, this is about the impact and the outcomes. So tell us a little bit about how you're measuring success of these programs, right? I mean, is it, both on the, kind of patient side as well as, sort of nursing satisfaction? What are the metrics that we are looking at?
Do you want me to start?
Yeah.
Sure.
Yeah.
Well, so obviously on the financial side, we all need to be respectful and observant to financial drivers. When you look at the opportunities for virtual care to impact financial aspects. It starts in my mind with replacing that one-on-one sitter concept that has evolved and become its own being over time. There are definitely other ways to manage that. Virtual observation is one way, and that truly is where the driver for that return on investment financially is going to happen. And then there are metrics involved that also revolve around that. HCAHPS is another area where looking at the patient's experience of care, did they feel cared about? Did they feel heard? How was their communication with the nurse? What did they feel their responsiveness was from the staff? Those are all metrics that observation can drive. And again, when you start with that firm foundation and then be able to bring others into that environment, as Becky said, that pharmacist, maybe it's a pastoral care person, maybe it's a child and they need child life in there because they're afraid about a procedure they're about to have, so they're going to do some guided imagery with them. So the ability to bring resources into the bedside without the barrier of geography, sorry, is something that I think is so very important for us to think about. And really, it's a leveling factor. But then moving on beyond all of that, how do we then protect, elevate, and restore the resilience amongst the nursing staff? And I think virtual care, it represents a pathway for senior nurses that they can still impact care at the bedside, but be working virtually. They can develop the expertise of the next generation virtually. So it allows for a new pathway, a new career. For the bedside nurse, I remember having very sick patients very early on, and I will remember those as long as I live because it was something I hadn't experienced before. So if you have the benefit of having a senior nurse that is just a click away to say, let's review this assessment together, definitely can level set and be a very teachable and rewarding professional situation. And then obviously, we're all doing all of this for patients, for better individual outcomes, for better population outcomes, and the opportunity to meet patients where they are virtually, bring resources in virtually. To me, this is like the new frontier, and it's a responsibility, though. I think all of us in leadership positions need to be accountable for continuing the incredible change management work that needs to happen to shape this, because as it has been said many times today, it's not always going to be right or perfect first, but how you learn from every situation and get the next cycle better and improved, and learn from each other, scale it, and share the results. That's how we collectively win and provide better care for our patients.
I couldn't agree more. The financial aspects are, of course, that usually the key drivers of any good pilot, then expansion of looking at what was the cost, what was the decreased turnaround time, what was the throughput of our patients. Often those are aspects that are looked at when leveraging virtual nursing, whether that's transferring a patient from one department to another, or it's doing straight virtual care. One of the organizations I work with, I thought it was really interesting. We had a sitter program in place. So a physical sitter would go and sit with patients. And actually, when we put that person virtually, we actually improved patient satisfaction. This was a pediatric patient population. It was teenagers. You can imagine teenagers don't want a stranger person come in their room every 8 hours or 12 hours and sitting there. And we actually got better satisfaction from the patients and the families, and we actually got better observations from the staff, because it was easy to get distracted having conversation with the patient or whatever it might be. So what we found was the quality of the interactions and of the observation went up, the patient satisfaction went up. So it was a win-win. And it was an aha moment. And that was the benefit of really listening and looking at the data. So we could look at the data, but yes, we talked to the patients, and yes, we talked to the nursing staff that were doing the virtual sitting, as well as the virtual nurses that were receiving that support. and really drew out those comparisons to look at the data even further. So that's the other thing, is you just have to listen really good along the way. So yes, the financial drivers, yes, you have to be willing to expand into other spaces. And I absolutely love, 80% of the workforce are women. Women go through a different life cycle within a 30 to 40-year nursing career. They may have children at home. They may have to take care of another loved one. They may need to, instead of being on their feet for 12 hours a day in a very busy department, need to look at other career options. And to me, I think this has been a great opportunity to really expand their careers, give them opportunities to still be involved, still give back, and also to leverage the virtual nursing as a support. Another organization I worked with, that's what we did for new grads. We actually paired them up with a virtual nurse. So yes, the virtual nurse was there to help with patient care, but really help give support to the new nurse. So usually the way that workflow would happen is the new nurse would talk to the virtual nursing staff before going into the patient's room and say, okay, I'm going to go in and this is the first time I'm doing a urinary catheter. I need your support. And then the virtual nurse would pick up on that anxiety, go into the room virtually, and would talk to the patient while the nurse could set up the tray and not be nervous and not be distracted by a patient talking to them. And so it was really a great partnership. And then again, afterwards, really enforce great things that happen, really help support the experience. So really, virtual nursing can do any and everything almost for a patient, and we need to leverage every single aspect, squeeze every drop of lemonade out of that technology, and share it to make it better for everyone in the future.
Well, thank you, Becky. That was an amazing way to close. And that really encompasses it. I mean, it's about the patients, it's about the care, and then it's also about the nursing experience from beginning to the end of the career. And the impact is huge. So thank you both. It's been a pleasure. I could do this all day. I've learned so much, and I hope our audience has. But Carol, I will hand it back to you.
Yes, thank you.